Welcome to the CPHIMS Exam Preparation Podcast. In today's episode, we'll delve deep into understanding the effects of widely recognized laws, regulations, accreditations, and various state and local mandates that oversee crucial healthcare information and system management services. Our focus will be on crucial areas such as privacy regulations, pharmacy standards, care environments, and the rights of patients. So, let's unpack how these regulations shape and influence the healthcare industry. Privacy regulations, for example, HIPAA in the U.S. HIPAA, the Health Insurance Portability and Accountability Act, is a landmark piece of legislation in the U.S. that has had profound implications for healthcare providers, insurance companies, and many entities that deal with health information. Here's a breakdown of its impact. 1. Establishes national standards for electronic healthcare transactions. Impact: by standardizing the way electronic health transactions are conducted, HIPAA ensures consistency across the board. This streamlining aids in simplifying processes, reducing administrative burdens, and improving the efficiency of healthcare operations. 2. Ensures the security and privacy of health data. Impact: with the rise of digital health records and systems, the risk of data breaches and unauthorized access has grown. HIPAA requires entities to have robust security measures in place, ensuring that patients' sensitive health data remains confidential and secure. This has given rise to an entire industry dedicated to healthcare IT security. 3. Mandates that patients have the right to access their medical records. Impact: empowering patients to view their health records promotes transparency and allows them to be more active participants in their health journey. This can lead to better patient engagement, understanding, and outcomes. 4. Noncompliance can result in severe financial penalties. Impact: with the threat of substantial fines, organizations are incentivized to strictly adhere to HIPAA guidelines. This means investing in training, security infrastructure, and regular audits. It has led to a culture of vigilance and increased scrutiny around health data management. 5. Ensures that healthcare providers use and disclose protected health information, PHI, only for essential purposes. Impact: this restricts the unnecessary sharing of health data, ensuring that it's used only for critical healthcare operations, payment, and specific other permitted purposes. It provides patients with the peace of mind that their personal health information won't be disclosed without their knowledge or used for non-essential purposes. In essence, privacy regulations like HIPAA have reshaped the healthcare industry's landscape, emphasizing patient rights, data security, and organizational responsibility. The overarching goal is to maintain the trust between patients and healthcare entities, ensuring that health information is used responsibly and ethically. Pharmacy regulations. Pharmacy regulations play a pivotal role in ensuring the safety, efficacy, and security of medications provided to patients. They have significant implications for pharmacists, pharmaceutical companies, and the entire healthcare system. Let's delve into the impacts of these regulations. 1. Set standards for the practice of pharmacy. Impact: by establishing specific standards, pharmacy regulations create a uniform benchmark of care and service that all pharmacies must adhere to. This ensures that patients receive consistent and high-quality care regardless of where they access pharmacy services. 2. Ensure that pharmacies employ licensed professionals. Impact: mandatory licensure and continued education for pharmacists and pharmacy technicians ensure that pharmacy staff are equipped with the latest knowledge and skills. This also ensures that only qualified individuals are responsible for critical tasks like medication dispensing, which reduces the risk of medication errors and ensures patient safety. 3. Adhere to safe dispensing practices. Impact: safe dispensing practices, such as double-checking prescriptions, using child-proof containers, and providing appropriate labeling, reduce the risk of medication misuse and potential adverse reactions. This not only ensures the safety of patients but also bolsters public trust in pharmacies. 4. Regulate the manufacturing, sale, and distribution of drugs. Impact: this is crucial in maintaining the integrity of the drug supply chain. By setting stringent standards for drug production and distribution, pharmacy regulations prevent counterfeit, substandard, or contaminated medications from reaching patients. Additionally, by monitoring the sale of certain medications, especially controlled substances, regulations help in combating the misuse and abuse of drugs, thus addressing broader public health concerns like the opioid epidemic. In summary, pharmacy regulations act as a safeguard, ensuring that every aspect of the pharmaceutical process, from manufacturing to dispensing, operates with the highest standards of safety and integrity. This not only protects patients but also reinforces the credibility and professionalism of the pharmacy industry. Environments of care. The environments in which healthcare is delivered play a crucial role in determining patient outcomes, staff efficiency, and overall healthcare quality. Regulations and standards associated with the care environment are paramount to ensure safety, efficacy, and optimal health outcomes. Here are the impacts of regulations related to the environments of care. 1. Enforce safety standards in healthcare facilities. Impact. By imposing rigorous safety standards, these regulations ensure that healthcare environments, from hospital rooms to operating theaters, minimize risks. This results in reduced incidence of hospital-acquired infections, accidents, and other preventable adversities. For patients, this translates to improved recovery rates and overall health outcomes. For healthcare workers, it means a safer, more conducive working environment. 2. Mandate regular inspections and risk assessments. Impact. Regular inspections mean that facilities remain constantly vigilant about maintaining standards. This proactive approach ensures that potential issues are identified and rectified before they escalate into significant problems. By conducting risk assessments, healthcare facilities can predict potential challenges and make informed decisions about resource allocation, training needs, and infrastructural changes. 3. Ensure that facilities are equipped to handle emergencies. Impact. Whether it's a natural disaster, a power outage, or a fire, emergencies can be detrimental in healthcare settings where patients might be critically ill or immobile. Regulations ensuring that healthcare facilities are equipped for such emergencies mean that in the face of adversity, these institutions can continue to provide care. This might involve having backup power systems, fire safety protocols, evacuation plans, and emergency equipment. As a result, potential chaos can be transformed into organized response efforts, significantly reducing the risk to life and infrastructure. In essence, the environment of care regulations underscores the belief that the quality of healthcare is not just about medical interventions but also about where and how these interventions are delivered. By ensuring safe, efficient, and patient-centered care environments, these regulations uplift the overall standards of healthcare delivery. Patient rights. Patient rights are a foundational concept in healthcare, emphasizing the importance of treating individuals with dignity, respect, and autonomy. These rights ensure that patients are not just passive recipients of care but active participants in their health journey. Here's the impact of regulations related to patient rights on the healthcare industry. 1. Right to informed consent. Impact. Ensuring patients have the right to informed consent means they are provided with all relevant information about a proposed medical intervention, including its benefits, risks, and alternative options. This fosters a transparent doctor-patient relationship, reduces chances of medical malpractice, and ensures that patients are making conscious decisions about their health. It shifts the healthcare paradigm from being provider-centric to being patient-centric. 2. Right to confidentiality, privacy, and access. Impact. Respecting a patient's right to privacy builds trust. Patients are more likely to share essential details about their health if they believe their information will remain confidential. At the same time, granting patients access to their records empowers them to be active participants in their care, leading to better patient engagement and improved health outcomes. 3. Right against discrimination. Impact. Discrimination, whether based on race, gender, socioeconomic status, or any other factor, has no place in healthcare. Regulations against discriminatory practices ensure that healthcare services are equitable and accessible to all. This not only fosters an inclusive healthcare environment but also improves community health outcomes as marginalized groups receive the care they deserve. 4. Right to make decisions about care. Impact. Recognizing the patient's autonomy and their right to make decisions, including refusing treatment, ensures that healthcare providers act in the best interests of the patient and not just on clinical judgments. This respect for patient autonomy fosters mutual respect and understanding between patients and providers. It also ensures that treatments align with the patient's values, beliefs, and personal health goals, making healthcare truly holistic. In conclusion, regulations related to patient rights have revolutionized healthcare delivery, emphasizing patient autonomy, respect, and dignity. By placing the patient at the center of care, these rights lead to better patient-provider relationships, improved trust, and, ultimately, enhanced patient outcomes. Safety and security regulations. Safety and security regulations play a critical role in shaping the environment and practices within healthcare organizations. By emphasizing the well-being and safety of everyone involved, from patients to providers to administrative staff, these regulations are instrumental in maintaining the integrity and trustworthiness of healthcare institutions. Here's the impact of safety and security regulations on the healthcare industry. 1. Protection of vulnerable populations. Impact. With rigorous safety and security measures in place, healthcare facilities can ensure that vulnerable populations, such as children, the elderly, and those with cognitive impairments, are protected from potential threats or harm. This fosters an environment where patients and their families can seek care with peace of mind. 2. Confidence in healthcare institutions. Impact. Knowing that a healthcare facility prioritizes safety and has security measures in place boosts public confidence. When individuals trust that they are safe within a medical facility, they are more likely to seek timely care and follow medical advice. 3. Prevention of unauthorized access. Impact. By restricting unauthorized access, healthcare facilities can prevent theft, protect patient privacy, and ensure that medical equipment remains uncontaminated. It also safeguards sensitive information from potential data breaches, protecting both the institution and its patients. 4. Mitigation of internal threats. Impact. Safety and security training for staff can reduce risks related to patient altercations, staff disputes, or misunderstandings. This not only ensures a safe environment for patients but also promotes a positive work atmosphere for healthcare providers. 5. Safe handling and disposal of hazardous materials. Impact. With regulations guiding the use, storage, and disposal of hazardous materials, there's a reduced risk of accidents like spills or exposures. This not only protects the health of those within the facility but also ensures environmental safety. 6. Preparedness for emergencies. Impact. Safety regulations often mandate emergency preparedness drills and protocols. This ensures that healthcare institutions are ready to respond efficiently during crises, be it natural disasters, power outages, or other emergencies. In conclusion, safety and security regulations are not just about compliance, they are about ensuring the well-being of every individual within a healthcare setting. By adhering to these regulations, healthcare institutions can offer a safe haven for healing, fostering trust, and ensuring the overall well-being of the community they serve. Alright, that brings us to the end of this podcast. If you found it informative, please like, share, and subscribe.